Sarah is just your average sophomore. She loves playing soccer with her team, drinking milkshakes at Chick-fil-A, and hanging out with her friends at the movies. But recently, something has started to change. Getting out of bed every morning seems like a pointless chore to Sarah now. Even when she forces herself to get up, she can't concentrate in school and doesn't enjoy eating lunch with her friends. She doesn't feel interested in sports like she used to. After days of crushing fatigue, Sarah decides to quit the soccer team. She hasn't felt very hungry lately and doesn't want to eat her favorite foods. She can't seem to feel happy about anything that used to excite her. Worst of all, she's plagued by sadness and reoccurring thoughts of her own death. Fortunately, her parents notice the change and take her to see a counselor who diagnoses her with major depressive disorder, better known as clinical depression. Defeating Depression by Otsuki. Depression is a global problem that impacts millions. The World Health Organization calls depression the leading cause of disability worldwide and estimates that 350 million people suffer from it. That is more than the entire population of the United States. It is also estimated that as many as 1 in 8 teenagers has depression. In other words, 1 in every 8 of your classmates and friends. At its best, depression is a heavy emotional burden. At its worst, it's life-threatening. Suicide is the second leading cause of death for people between the ages of 15 and 24. In the United States, somebody commits suicide every 12.3 minutes, resulting in 38,000 deaths every year. And that is only a fraction of the 800,000 deaths worldwide. Perhaps you know somebody who has depression, or maybe you suffer from it yourself. Though it may not seem like it, there is hope. Even people with severe depression can make tremendous recovery. The National Institute for Mental Health found that 80 to 90% of teens who seek help are treated successfully. So, what should we do now? We need to understand the science behind depression, and then how to respond. All information is from Suicide Awareness Voices of Education, the National Institute for Mental Health, ASAP Science, and TED Ed. Depression can look entirely different than we would expect. Having depression doesn't necessarily mean that you feel sad all the time. It can also cause you to feel irritated, angry, or lethargic, anxious, or even incapable of experiencing emotions, like suffering the death of a loved one, but not feeling the pain or sadness of the loss. So if depression can look so different, how do psychologists determine if somebody has it? Under psychiatric guidelines, you qualify for clinical depression if you experience at least 5 symptoms for 2 weeks. Symptoms can include a persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakenings, or oversleeping, appetite or weight changes, thoughts of suicide or death, and aches, pains, headaches, cramps, and digestive problems that don't have a clear cause or don't ease with treatment. Though doctors are not entirely sure what causes depression, they know a few things. First, depression is somewhat genetic. In the same way that you're more likely to be alcoholic if your parents are, you're more likely to have depression if you have a family history of it. Scientists have even isolated specific genes that increase your risk. For example, every person has 2 copies of the serotonin transporter gene, one from mom and one from dad. Each gene is either long or short. People who have at least one short version are more likely to have depression. There are also biological factors. Depression is associated with low levels of serotonin, norepinephrine, and dopamine, chemicals which contribute to focus and feelings of happiness. Because they are released during workouts, people with depression are encouraged to exercise. Scientists even see physical differences between the brains of average and depressed people. The longer you have depression, the more your frontal lobes and hippocampus shrink. These areas control decision-making, memory, and emotion, which could explain some symptoms of depression. Lastly, environmental stresses and traumas increase risk of depression. Stresses can be major life changes, like moving or the birth of a child. Traumas can include the loss of a loved one or a disaster of some kind. It is important to note that the experience of depression is different for everyone, so there is no silver bullet or one-size-fits-all treatment. But if you have depression, know that you have options. For starters, there are non-medical, discussion-based tactics like psychotherapy. With this treatment, people talk to a counselor to process emotions and discover ways to address personal problems. One very effective form is cognitive behavioral therapy, which aims to address people's perspectives and behaviors in order to change their emotions. Some patients with mild to moderate depression can overcome it with CBT alone. Even for those with extreme depression, therapy is often key to recovery. In those cases, therapy is frequently paired with medication. These regulate chemicals, like serotonin, and increase neurogenesis, the growth of brain cells. This helps replace lost cells in the hippocampus and frontal lobes. Those with depression should never feel ashamed about looking for help. Depression isn't evidence of weakness. It is a legitimate medical condition. You wouldn't expect somebody to just snap out of an asthma attack or just get over their diabetes. And even if friends or family don't recognize that, doctors do. If you know somebody with depression, encourage them to seek guidance from a professional who can tell them what kind of treatment will be the most effective. Be gentle. Remember how hard it can be to seek help, especially when fearing social stigma or feeling guilty or ashamed of your condition. On average, it takes 10 years for someone with a mental illness to seek help. Offer to help them find a therapist in your area, or write down questions for them to ask when they go. If you've never experienced depression, avoid comparing it to times when you felt down. Normal sadness, anxiety, and fatigue are completely different from clinical depression. Equating them to depression could make your friend feel guilty or upset for not just getting over it. Be open to conversations about depression. Just speaking freely about it lessens social stigma and allows you to better understand what's going on. Simply asking somebody about suicidal thoughts can decrease their risk of suicide. When you talk about depression, be careful not to make comments that trivialize such a serious issue. Don't say things like, "Happiness is a choice. No pain, no gain. There's always somebody worse off than you are." People with depression don't need to hear fluffy platitudes. What they do need to hear is your support. You're not alone in this and you aren't going crazy. I've never experienced what you're going through, but I want to help you however I can. What can I do? Understand that they might not know what they need and that they aren't going to get better overnight. Recovery is a process of growth. If you are experiencing suicidal thoughts or extreme depression, you can call the National Suicide Prevention Lifeline or a trusted friend. Though the situation may seem bleak, there is always someone who can help. To sum it all up, depression is a complex and difficult issue that can seem overwhelming to address. But in every storm cloud of this issue, there is also the potential for rain that waters seeds of progress, healing, and hope. In order for any of these things to take root, we need to be observant enough to see people hurting behind fake smiles, understanding enough to give them the help that they need, and passionate enough to change the statistics.